And welcome back. New York City is home to thousands of children and families facing immense challenges, from housing insecurity to mental health struggles. But during these difficult times, there is one organization that's dedicated to providing critical support and ensuring that no child is left without the care that they need. Here to discuss more are Good Shepherd Services Senior Vice President Ellen O'Hara and Director of Community and Government Relations Annie Minguez. And thank you so much for joining us.
Thanks for
Thank
having
you.
us.
Thank
Thank
you.
you.
And, when we talk about preventative work, obviously there's a great amount of preventative work that Good Shepherd does. But unpack that for us so that way people can become a little bit more familiar with what preventative work is.
Absolutely. Preventive services, the goal of preventive services is to keep families together and out of the child welfare system. There are prevention programs throughout all of New York City that are contracted with ACS. And it is on a continuum from family support services to therapeutic services. Good Shepherd has 6 preventive services, 4 in the Bronx. And the 4 that we have in the Bronx all provide counseling services. We provide case management services, and we also provide resources as well as crisis intervention when needed. And again, the goal is for us to work with families to keep everybody together and out of the child welfare system.
Can you give me an idea as to what you're seeing these days? I mean, you're the ones with boots on the ground. Are you seeing more and more come through your door, more and more cases that you're having to deal with, or are we seeing a decline?
We are seeing more cases coming through. I think the one thing that came out of COVID is the normalization of support and mental health services that people need. So I do think that people are reaching out and asking for support sooner versus later. And we also have started up a new program, which I guess we will probably talk about later. But we are seeing a lot of families come through our doors with a lot of food insecurity, mental health challenges, um, immigration things that are going on right now has been a huge concern for a lot of our families.
Yeah. And in tough times like these, the way organizations seem to survive and really do the great work is by the power of collaboration. Give me a little bit about the collaboration efforts that Good Shepherd is engaging in.
So we've been working and really elevating parent voice. That has been a really big work that we've been doing this year, last year and this year, really focused around how we, as part of a larger child welfare system, can really elevate the voices of families and center them. Families want more prevention work to be done. They don't want children to be removed. This is one of the reasons why Good Shepherd Services authored a article talking about the CARES model, which the Administration for Children's Services has implemented, and we support. It's research based. It's basically recognizing that not all cases reported into the state registry is a case where a child is in imminent danger and require child removal. This really allows ACS to support the families and the children in their home, and it's preventive work, and that's the work that we have been doing in communities for years, and we see that we're able to build trust in communities. We're able to work across agencies to really dive into what is our role in ensuring that we can keep families together and support them with whatever needs they have. So moving away from um, uh, focused on like the removal, but really like what are the supports and how do we surround families with those supports?
Yeah. When we talk about Black and Latino families and we talk about the child welfare system, we know that there are gross inequities that exist. And I mean, everybody will testify that there's still issues that need to be resolved, longstanding issues that need to be resolved. But as an organization, what are you doing, if you will, to really, address this, given the fact that we know that it's very prevalent?
Sure, I can start and then maybe Ellen can kind of like continue. Good Shepherd Services has been on a journey, anti-racism journey for the last 6 years. And part of that work is looking at like who are the families that are impacted? How are we a part of the larger system? How do we center family voices? How do we leverage our power as agencies to push back on possibly some policies that are really impacting families. Again, why as an agency we've come out and said to ACS, thank you for looking at other ways that we can support families. We have been working very closely with JMAC Families. This is an organization that's founded by parents of lived experience with the foster care system and have been really engaging around how we as agencies in the community can really support the work that families need to see us doing in the community. We do really good work, and yet still we're finding that we could be doing more to support families and to ensure that when they are touched by the child welfare system, that they feel that they have the rights, that they know what their rights are, and that they are most supported in the community.
Yeah,
Ellen?
and
And
yeah, keep going, Ellen. I'm sorry, I don't want to cut you off.
Mhm.
that's okay. Good Shepherd was just awarded a contract through ACS called We are naming it the Family Counseling for School Success, and it is a program. Schools have been the predominant source of call in to the state central registry, with most of the cases called in unfounded. So ACS put out an RFP for contracts for providing preventive services connecting with several schools. So for Good Shepherd, we have that contract and we're working with 3 schools in the Fordham Morris area so that when challenges are happening in the school, instead of the school calling that case into the state central registry, they're reaching out to us so that we can provide support because most of those call ins are often related to poverty issues or challenges that could be remedied by seeking counseling. So that is another way that we are really working to reduce the inequities that are happening within the systems.
Yeah. Well, I know you're doing great work. I gotta go, but I gotta ask the question before I leave: how can the public really do a job of supporting the work that's going on there?
Go ahead, Ellen.
Well, if anybody is in need of support, to reach out, to absolutely reach out to, as I said, Good Shepherd has 4 programs in the Bronx. They can call our main office number at 718-924-2511, and just really ask for help if they need help. We are here to help.
Yeah. Well, thank you for the work that you're doing, Ellen and Annie. Thank you coming to us from Good Shepherd, and we want to thank you for being with us. And we'll talk to you soon. Thanks much.
Thank you.
Thank you very much.
All
Take
righty.
care.
Well, now,
Bye
if you
bye.
want more information, please visit the website at goodshepherds.org. That is goodshepherds with an S.org. All right. Don't go anywhere. We'll be back more open coming up right after this.